Hello mates, my name is Lee. Today I will be discussing workplace realities, as they pertain to nursing regulation. Let's get started. I will explain terminology as it relates to unions, regulatory bodies, and scope of practice. Then I will bring in union members to discuss union views and nursing regulation. Unions advocate for socio-economic interest of members, lobbying regards to members' salaries, working conditions such as professional practice environments, and safety. Professional regulatory organizations are primarily focused on the protection of the public by setting requirements to enter the profession and establishing and enforcing practice. Activities that nurses are educated and authorized to perform. Different nursing roles and responsibilities within the workplace, knowledge and skills nurses have as individuals. I defined the previous terms as there is often confusion between union and regulatory body roles. To elaborate, I will introduce you to two local union members.
Hey guys, I'm Ron. I am a licensed practical nurse and I belong to Local 3967 QP, Canadian Union of Public Employees.
And I'm Kate. I am a registered nurse and a member of SUN, Saskatchewan Union of Nurses.
Here are some interesting facts about QP. Please pause the video and click on the link below to watch this QP ad, as described here. Enjoy!
Here are some interesting facts about SUN. If you wouldn't mind, please pause the video and click on the second link provided below. Cheers!
Thanks for the introduction to your respective unions, and thank you for being here today. I recently learned that the first nursing union was formed in Quebec as early as 1939.
That's right, Lee. More than 80% of nurses in Canada belong to a union. The Canadian Federation of Nurses Unions, CFNU, represents approximately 200,000 nurses and student nurses.
Thanks, Kate. Here's a question for both of you. What do you like about being a member of the union you belong to?
Lee, I have great benefits. My kids need glasses and dental care. My union helps fight to ensure these services are covered adequately. It's a great perk of being a QP member.
To expand on Ron's response, SUN protects and advances my health, social, and economic well-being, not to mention job security, seniority, and fights for competitive wages.
Thanks, Kate and Ron, for sharing. Those are some great perks to being a part of unions. Can you elaborate on what aspects of your unions that you are not particularly fond of?
Well, because QP represents a variety of other professions, seniority plays a key role in hiring. For example, a new LPN grad may have 10 years of seniority from dietary. This LPN will trump an LPN with 9 years of nursing experience on a job posting. Therefore, I don't feel like QP has my best interest as a nurse in mind.
Wow, Ron, that sounds like it can have an impact on patient safety. Hiring a less experienced nurse with higher seniority, from a different field of work unrelated to nursing itself.
One of the downsides I find, Lee, is my loss of autonomy. Even if I don't agree with the union decision, I still have to play along, until it's time to go back to the bargaining table.
I bet a 4-year wait to return to the bargaining table can feel like an awfully long time. Moving on to the next question. Have you considered effects of a joint nursing union?
Well, Lee, there would definitely be strength in numbers at the bargaining table. In fact, Many Canadian provinces and territories have merged into one union for all nurses.
We are all nurses regardless of designation. A joint union would allow us to better collaborate, rather than being pitted against one another, as you may have seen in the media.
As far as I'm concerned, Kate, collaboration doesn't need to be union-specific. We should be working together to promote both professionalism and patient safety.
I have to ask you, Kate and Ron, could you clarify to our viewers what exactly the difference is between an RN and an LPN?
Well, Lee, it boils down to education. I have a 4-year bachelor's degree, while Ron has a 2-year diploma. RNs are trained to see the whole picture, which is vital to patient safety.
To be fair, diploma RNs have 2 years of education, the same as LPNs. Some difference in your degree education can be attributed to non-essential electives.
Diploma RNs receive a lower wage in comparison to degree RNs. If we share a union with LPNs, what is going to happen to the wage bracket? There is already fear of LPN's scope of practice infringing on RN territory due to affordability, especially with the current economic landscape of our province.
I'm learning lots from this discussion, but before things get too heated, let's move on. Do you think that a joint union would reduce role confusion at the patient bedside?
It is not the role of the union to clarify nursing bedside roles. This is the job of the regulatory body, such as SRNA or SALPING, through scope of practice framework.
I happen to believe that separate unions aid in role clarity. What about seniority if our unions were to merge? Or how would our current benefits change?
I envision a benefits package that is the best of both worlds, such as top-up pay for maternity leave that the RNs currently receive that the LPNs do not, or short-term disability benefits that the LPNs have in the contract that the RNs do not have. Also, Lee, overtime for LPNs goes by seniority where RNs go by fairness. And this is just the tip of the iceberg. I am not saying I am pro-joint union. However, these contract discrepancies cause confusion and sometimes resentment.
I too am not sure where I stand with a joint RN-LPN union. However, I agree with what Ron just spoke to.
Thank you for your candidness. There definitely appears to be many advantages and disadvantages to a joint or separate union that encompasses all nurses. Education and professional practice for both RN and LPN uphold the same principles in the philosophy of healthcare. So why aren't all licensed nurses represented under one body? I appreciate Kate and Ron spending the day here helping to address this issue, offering a member's perspective from both unions. And thank you all for tuning in on this hot topic.